Developed by the Centers for Medicare and Medicaid Services, or CMS, Level 2 Hcpcs codes are also referred to as national codes. National codes are designed to report physician and non-physician services such as drugs, chiropractic services, dental procedures, durable medical equipment, and other selected procedures. Although national codes were developed for Medicare, they are also used by commercial payers. Coders should note that some Medicare carriers mandate the use of Level 2 codes rather than the specific CPT code. For example, there's a CPT code for removal of impacted cerumen, 69210, but CMS will deny payment for this code. Hcpcs Level 2 code G0268 should be reported for the earwax removal procedure. Bulletins from Medicare carriers announce such mandates. Some Medicaid programs and private insurance carriers also may accept or mandate the use of national codes. These codes are updated every year by CMS. Level 2 Hcpcs codes consist of 5-digit alphanumeric codes beginning with the alphabetic character A through V, excluding S, followed by 4 numbers. They describe services and supplies such as drugs and durable medical equipment. Level 2 modifiers are used in Hcpcs Level 2 and were developed to serve the same purpose that modifiers in the CPT codebook serve. The assignment of a modifier may indicate that a service or procedure was modified in some way, but with no change to its basic definition. Hcpcs modifiers can be used to indicate the following types of information: whether the service was supervised by an anesthesiologist, the service was performed by a healthcare professional other than a physician, such as a clinical psychologist, a nurse practitioner, or a physician assistant. The service was provided as part of a specific government program. The service was provided to a specific site of the body. The equipment was purchased or rented, or whether there were single or multiple patients that were seen during a nursing home visit. In the coding of Medicare claims, Hcpcs Level 2 modifiers may be used with the national codes or with CPT Category 1 codes. Here we have an example of a few of the modifiers: E1 for upper left eyelid, LT for the left side, and U for new equipment. Hospital-required modifiers began April 1st of 2000. For your reference, an abbreviated list on the inside cover of the CPT codebook and in Appendix A of CPT are noted. Everything is not on the inside of the book, but there are a selected few for usage and for easy reference. The national codes are divided into many sections. Here to name a few or show some examples are A for transportation services, including ambulance, medical and surgical supplies, administrative and miscellaneous and investigational codes. D for dental procedures. J for drugs administered other than oral method chemotherapy drugs, and just to name a few. Remember that the general guidelines for Hcpcs Level 2 coding is just like CPT coding guidelines. Never code directly from the index. Search for the main term and any applicable subterms. Note the reference codes as given in the index, and then verify the code by reading the entire description.